Autism is a neurodevelopmental disorder that occurs either in utero or early in life. Some children, infants, appear to be perfectly neurotypical early in life, for like the first year or two. They get an infection, for instance, and within 3 months of that serious infection, start showing signs of autism spectrum disorder. And we have clear ways to understand all of that. Researchers have looked at the brains of people with autism spectrum disorders and have noticed all sorts of metabolic and mitochondrial problems. Low levels of ATP in brain cells, higher levels of brain inflammation, higher levels of reactive oxygen species, other things. So all of those point to, wait, this is a metabolic or a mitochondrial problem. For those who don't know, rates of autism have skyrocketed in the last 40 years. Over the last 20 years, rates have tripled.
Whoa.
20 years, triple the rate of autism. A lot of people are like, well, that can't possibly be true. Well, the researchers who are studying it and the people who are doing the household surveys are saying it's true. So either keep your head in the sand and be in denial about it, or open your eyes to this is happening. We have a skyrocketing mental health crisis in the world.
How do we know this isn't just an increase in diagnosis and it's always been this way and we're just now diagnosing it more?
Looking at the household surveys, researchers funded primarily by the United States government go door to door to a random sample of households throughout the United States, ask the people who answer the door a series of long lists of questions about mental health conditions, and make estimates of how many people are suffering from different mental disorders. And the rates are increasing. They're particularly increasing in the young population. A much harder kind of variable that is indisputable is the rate of death from mental illness, which we probably, the most comprehensive figure that we have is something called the deaths of despair, which includes suicides, but also overdoses on drugs and alcohol. That rate has doubled over the last 20 years.
God damn.
In the population.
That's really brutal.
The rate has doubled. People aren't faking their deaths. They're not whining and complaining. So there's a lot of skepticism about mental health because there's no objective tests and everybody thinks, everybody thinks they've got autism these days. Everybody's just complaining about being autistic because they want sympathy. Well, guess what, folks? The rates are really skyrocketing and we can't keep our heads in the sand. So how can we understand that in the context of the brain energy theory? If the brain energy theory is really true, how can we understand that? And what I would say is I will share a couple of observations, but the most important ones. Women who are pregnant, if they are obese and also have poorly controlled diabetes, such as gestational diabetes, they have a 3 to 4-fold increased risk of having an autistic child.
Whoa.
If you are a man with obesity compared to a man who has healthy weight, the obese man has double the risk of having an autistic child.
Whoa.
So people are asking this question, where the hell is all this autism coming from? That's impossible. Autism is supposed to be genetic. Well, look at statistics like that. Look at some common sense observations. Is obesity increasing in our population right now? Are the rates of diabetes increasing in our population right now? Does this apply to childbearing women? Does this apply to men who are about to become fathers? So to get very clear and concrete with my theory, so people who are overweight or diabetic are more likely to have autistic children. Why? What I'm arguing is that people who are overweight or diabetic have a mitochondrial problem. They have a metabolic problem somewhere in their brain or body. That is what is causing their obesity, and that is what is causing their diabetes or their insulin resistance. That obesity and diabetes are symptoms. Obesity and diabetes are not causes, they are symptoms. They are symptoms of metabolic derangement somewhere in the body or brain. And that means that these people already have a mitochondrial problem somewhere in their body or brain. That mitochondrial problem is getting transferred to their gametes. Those gametes are going on to create a child. That child is at higher risk. Again, this is not absolute. It's not double the risk. It's not the overwhelming majority of children born to obese women are not autistic. But it increases the risk because you're increasing the risk of transmitting a mitochondrial problem or a metabolic problem or an epigenetic metabolic problem to that child, and that then results in a problem. The other strong possibility, so that's gametes and maybe some epigenetic signals, but the other strong possibility in particular with the women, because the women are not only contributing an egg, but the women are growing this child. And that means that the women's hormones play a role in the growth and development and neurodevelopment of this child. That means a woman's stress levels play a role. That means a woman's diet is playing a role. Levels of glucose in her bloodstream are getting into that fetus. That is affecting that fetus's development. Other question, so can we fix autism? Autism is a neurodevelopmental disorder. And what that means is that, the primary symptom of autism, there are really two buckets of symptoms. One bucket is social skills impairment or social skills differences, that people who are autistic relate to other humans in a different way. They might have trouble interpreting nonverbal social cues, for instance. The other bucket is that by definition, they have to have some kind of OCD symptoms as well. So if we focus on the social skills are hardwired into the human brain. We are all hardwired to develop appropriate social skills. As parents, we are hardwired to transmit this information to children. Children are hardwired to get this information, store this information, and utilize it effectively. Meaning, I have to get mom and dad to do what I need them to do to take care of my needs and make sure I don't die. Meaning, that when the child's old enough to start going out to school or the playground, I have to figure out how to navigate all of these other human children and get along with them, or at least not be bullied and teased by them, or navigate conflict. If they've got a ball and I want the ball, how do I manage that situation? Those are being acquired over time. It's not, you come out of the womb and you've got those skills. You don't actually have those skills at all. So a metabolic assault at any point in the timeline of the acquisition of those skills could impair the acquisition of those social skills and result in what we call an autism spectrum disorder. How does that relate to mitochondria and metabolism? Mitochondria are critical to neurodevelopment. They are critical to the differentiation of cells, and they are critical to something called neuroplasticity. So the branching of neurons to create new connections and synapses with others. They are critical to those processes. So if a fetus or a young child has impairment in mitochondrial function, those areas of the brain that are supposed to be acquiring social skills may be impaired, and that may result in them not getting them. The challenge with reversing that or correcting that is that if I take an extreme case, give me a 30-year-old person who is autistic now, can I change their autism? Can I make it go away? Can I somehow help them acquire social skills that are neurotypical? My strongest guess is no.
Oof.
And the reason I say no is because neurodevelopment has windows of opportunity. They're called neurodevelopmental windows. And the window opens, and then parts of the brain grow and thrive and branch out and connect and do all sorts of things. And then the window closes. You don't get to go back and redo it. So my strong guess is that social skills actually do undergo neurodevelopmental windows, and that humans need to acquire these skills in the right ways at the right times. The caveat to that is it does not say that neuroplasticity is impossible. So neuroplasticity is, could we get the brain to somehow form those connections that are missing? Could we get that to happen? It's conceivable to me, but it probably will not be a simple intervention. It won't be go on keto for 3 months and that'll fix you up. That's not going to do it. The ketogenic diet might even play a role. We've had studies of the ketogenic diet for autism. They can correct some of the cognitive problems. They can certainly correct the seizures that often accompany autism. They can also correct some of the mood disorder symptoms that can accompany autism. So they can have a powerful treatment role for quality of life and ability to function. But for the most part, most of the studies have not found any improvement in social skills.